Hello, everyone. Thank you for joining us tonight for this SLS monthly webinar. We are very, very honored and lucky to have Dr. Joshua Davidson with us this evening. So a little bit about him. He's the director of the Williamson Eye Center Dry Eye and Specialty Lens Clinic in Baton Rouge, Louisiana. He's an alumnus of the University of Michigan and a 2013 graduate of the Michigan College of Optometry. He's also a well-traveled speaker specializing in the topic of scleral lenses and advanced dry eye care. Dr. Davidson is the creator and co-owner of the Dry Eye Drink, the first product designed to improve systemic hydration, helping to alleviate the signs and symptoms of dry eye. So we're very excited to have you. Tonight, you'll be speaking about making your specialty lens practice a well-oiled machine, and we're all very excited to hear what you have to share with us. So without further ado, Dr. Davidson, take it away.
Great. Thanks, Dr. Kramer. I'm Dr. Davidson, and yeah, we're here to talk today about how to make your specialty lens clinic and really contact lens clinic what I think is a pretty well-oiled machine. So, hold on. There we go. So who am I? Yeah, like Dr. Kramer mentioned, I'm an MCO graduate, proud class of 2013. I'm also a proud Wolverine from the University of Michigan. I work at Williamson Eye Center, where, like she said, I direct the Dry Eye Center and the Scleral Lens and Specialty Lens Center. And actually, really kind of funny story here. The picture there in the lower right is the clinic that I normally work at. And right across the street, I don't know if any of you have been paying attention to the news, but you may have read about how the Mall of Louisiana in Baton Rouge recently got shut down. I think the last 2 or 3 days we've been shut down because they opened an aquarium there, and a 12-foot python actually got loose. So if you actually Google Mall of Louisiana, loose snake or python, you'll see it's all over the news. It's a big thing down here, and that's right across the street from where I practice. So kind of interesting little tidbit there. We are located in Baton Rouge. Dr. Kramer said it correct. It's got a little French flair there, or Spanish, I suppose. I've got a few disclosures Cope makes me do. I speak for Glaukos, Cala, Eyevance. I do some research for Eyevance and J&J. Allergan, I'm an advisory board, a speakers bureau. And like she mentioned, we've got a little unique product out there for dry eyes. So one quick thing I want to go over for those of you that maybe don't have, haven't been on some of these webinars before, what we've got there, what is the Scleral Lens Society? That is actually who's putting this on. And who that is it's basically a nonprofit organization that's really committed to educating practitioners and the public about how scleral lenses can benefit patients with corneal irregularities or ocular surface diseases. What do? We put on these awesome webinars. They may not be, as good as those in-person Denver, just like optometry's meeting in Denver that a lot of us were at, but they're pretty darn good. They're a lot of fun, and they're a quick way to kind of learn about how you can make things a whole lot better in your practice and your fitting. We've got a wonderful website that's full of resources. If you haven't been to SCleralensorg, check it out. That's where I do all of my training as far as having my staff learn how to do new things. I put them through basically a boot camp through SCleralensorg, and I have them watch all the videos multiple times, all that good stuff. This is just a picture of the main website. Something else I would kind of direct you to do is if you look in the upper right-hand corner, you'll see a Become a Fellow. And it's a great way to kind of hone your scleral lens fitting skills, learn a little bit, and really kind of push yourself to the limits, and you get those fun little letters after your name. So it's a really great thing. It's one of the best things I've ever done professionally. I've learned so much, met so many new people, and it's a great way to actually get new patients. So what are we talking about today? Again, I'm going to go over really quickly how our clinics are structured. We're going to talk about how you select your staff and how to train your staff, because it's really through the staff that I've made our clinic such a high volume, very efficient, very highly rated clinic. We're going to really lightly go over scheduling just because every clinic is so different. The office that I work at has 26 exam rooms. most people only have much less than that. So scheduling for me might not work the same way for scheduling someone else. And we're going to go over how the visits at Williamson Eye Center work, kind of what we've honed down through the years. Again, what is Williamson Eye Center? We got 6 locations, 5 surgeons, 10 optometrists. We've got a PA, and I run the Dry Eye Center Specialty Lens Center. I see about 30 to 40 dry eye patients a day, and I do about 3 to 5 new scleral lens fits a day. And that would not be possible if I didn't have everything just perfectly structured with incredible staff that have bought in and really made my life a whole lot easier. And it's through that staff, like I mentioned, that I think every single person on here could have a really efficient clinic that patients love, you love, and your staff loves. So one of the things that Williamson has done over the years, we've been around for 72 years, is we use something called physician extenders. This has been popular in ophthalmology and other areas of healthcare for quite some time. And thankfully, optometry is really kind of getting into that. By definition, a physician extender is a specially trained and licensed person who performs tasks that might otherwise be performed by the physicians themselves, under the direction of a supervising physician. Examples include nurse practitioners and physician assistants. In optometry, we've had this for a while, at least most of us had, with technicians. Scribes are becoming a lot more popular, and those are just extenders. But what I'm going to argue is how to use an extender in your contact lens practice. And how did I do that? I found myself a Robin. Miss Robin is, that is her name right there. Just found some cute pictures there. She is a wonderful woman, and she makes it so that I can single-handedly see so many more patients. And she is almost our contact lens concierge. Today, we're just going to focus on how you can use an extender, like a superstar technician, to help your specialty lens clinic. However, in the Contact Lens Spectrum magazine, March 2020 article or issue, so the one right before COVID, we wrote a really nice article that explains how we caught her, how we trained her, and actually what she does for anything from re-refractions to contact lens follow-ups to helping make sure our patients get the most of their benefits, their insurance benefits. So it's a really great article, really proud of it. She and I both worked a really long time on it, and we've gotten many compliments from folks just how great and how much it's helped them create a more efficient clinic. So I encourage you to check that out. So let's say that you want to run a more efficient clinic and you're already just pushed to the limits. You're already working as hard as you can. You're seeing as many patients as you can. And you say, how can we do things better? Again, what I would do is look inside your own clinic and try to find someone that you can train or potentially hire outside. Williamson's strategy is always to hire personality and then train skills. So when we were looking for this contact lens super tech, we really wanted someone that was very kind, gentle, caring, motherly is a really good way, especially with a lot of these scleral lens patients. As you know, they don't have a lot of confidence. They are very quick to get down on themselves, and someone that is there cheering them on, really, providing that kind of that support and that love, it works well for everyone. You've got to have a person that really is interested in learning more about eye care, especially the contact lens field. They've got to be likable. The way that we've structured our clinic is that this person is their concierge. They're the ones that the patient will call if there's an issue, if they have any questions. Robin is the one that deals with all that. So they've got to be very likable. Otherwise, patients just simply aren't going to kind of go through with it, and they're just going to kind of give up on the whole clinic. And they've got to be organized. And this is just one that, personally, I am not the most organized person out there. I'm pretty messy, to be honest with you. And Robin is a neat freak. So she keeps things clean for me. She organizes things. She keeps me in line. And that was really important. I knew that was going to be a very big thing that I needed when it came to finding someone to help me out. I included a couple quotes from that article. Robin says, overall, I serve as a team player and team leader when needed, which is more often than not, and help out in any aspect that I can at the clinic. This line is really, I think, summarizes what a good extender will do. She comforts patients or cheers them on. She truly loves it all. She's fortunate to be able to do what she loves day in and day out. And what a quote from me was, by finding someone who has a passion for contact lenses and patient care, not to mention a strong clinical acumen and an affable personality, your office could benefit exponentially from allowing a physician extender the opportunity to care for patients. After all, they're merely an extension of you. So let's say you found that person that you want to be your extender. Real quick, what do you need to train? Basically, you want to train them like a superstar technician. Make sure they know how to use the autorefractor. Anterior segment OCT. If you've got a pentacam, make sure they know that inside and out. Eaglet eye surface profile, same thing, as well as they should be able to take some photography of the anterior segment, whether that's behind a slit lamp or whether it's through slit lamp photography. Skills, I find it very, very, very important that the refraction is just as good as mine. So I spent a ton of time refracting, teaching Robin and others how to refract. That is so, so, so important. And you'll see why later in this presentation. Scheduling, obviously. Organization, I mentioned I'm very not organized. They've got to know how to do INR training. If you are a scleral lens practitioner and you're doing more than a few fits a week, a month, you simply don't have time to do that INR training. You need someone to do that for you. So how do we train them? We have Robin, but we've also trained a bunch of little Robins that are kind of, work in our other clinics. And what did we use to train them? Of course, Robin shows some of those skill sets, but there's a lot of really, really great resources out there to train your technicians. On SCleralensorg, again, there is a visit scheduling guide. So what that does is it just kind of gives you, the provider, a very good baseline for what's expected at each visit. So it's good for your superstar technician to kind of know, hey, this is what's going to happen at each visit. YouTube is where I send all my patients for INR training, to be honest with you. There's incredible resources there. I have all my staff and all of our little Robins train on and watch all those videos. It's always nice to not watch all the same video over and over and over again, but watch different videos. And they've got obviously insertion and removal. They've got some information that breaks down exactly what scleral lenses are, who they're used for, some common questions and answers about scleral lenses. I have our technicians just watch them all, okay? And they come back to me with any questions. So YouTube is a great, great resource. Again, the SCleralensorg site has got these 12 bite-sized little presentations. Just a quick little introduction to scleral lenses, to what's done on a follow-up exam, how you over-refract over the scleral lenses, which is a huge part. And basically, I really like that setting up your exam room for a scleral lens evaluation and all the supplies needed. So I had my staff really look at all these things, watch all these videos, and really make sure that they understood all of that. So SCleralensorg, once again, they've got great, great videos there. Become a member and really share the wealth there. There's also a lot of other great websites out there that have nothing to do with SCleralensorg or any of the labs or anything like that. This one in particular is owned by a woman named Rebecca. It's called the Dry Eye Shop website. And they have a whole plethora of information about scleral lenses. Patients can also go here and get all the products they needed, from the insertion and removal DMVs to all the salines, to the cleaning products, to the fillers. They've got everything on there, and they've just got a whole host of different articles. So I had my staff also look at this website. It's more geared towards the patients themselves. So it kind of breaks things down into a very basic concept, which is really great for beginners that are trying to learn how to help the patients. They've also got some Facebook groups, which are incredibly interesting to join. Robin was a part of those for a little while as well. GPLI, again, another great resource to have your patients look at. Books, okay, a lot of great books, including Melissa Barnett wrote this excellent one. Eve wrote an excellent free document there. I think it's like 30, 50 pages. Great basic rundown. That's also something that I've given to those technicians. And of course, your labs. Every lab has got some resources on there. Bausch & Lomb's Zen Lens, or I guess Alden Optical, they've got this great little fitting certification that you can put your technician through just to kind of learn more and get quizzed on it. Eventually, what's going to happen is when you do all this training and you really kind of find someone that loves what they're doing, you really, find that person, your right-hand man or woman. Eventually, what's going to happen, and we're going to get into this, is you can kind of give them the keys to the kingdom. This is a very typical email that Robin will send me. It was from last month, and Robin basically just said, "Hey, patient came up and picked up pair number 3. We average around 1.5 to 2 remakes, by the way. We flatten the edges by 1 step 360. She's seeing some edge standoff on the right eye, and we're getting some movement with each blink." So what's really, really nice there is it gives me an idea what to look for right away. And that just kind of shows the level of sophistication that Miss Robin's gotten in just a couple of years. And the best way I want to reiterate, when you find this good person, think of them like a contact lens concierge. They're the ones that talk to the patient the most. They answer a lot of the questions. Frankly, they spend the most time with the patient. The phone number there, the text only, that text only can actually go right to her cell phone during business hours. And then when they call that number in that extension, it's actually routed directly to her cell phone during business hours. So pretty neat. So the patient has actually got access to Robin pretty much at all times during business hours. It's worked out incredibly well. Our patients love it, and they love her. She is really the face of the clinic, and I wouldn't have it any other way. So real quick, how do we schedule? This is Robin's schedule. This is my schedule. Obviously, we see a lot of patients, but what I've done with her is I've given her just a whole day of 15-minute slots. And so if a patient needs to come in for an RX recheck or a soft lens 1-week follow-up, she takes it. So all the basic stuff that she feels comfortable with, she takes. Because honestly, the 1-week follow-up with the contact lenses, it's better on her schedule anyway. Multifocal 1-week follow-ups, monovision, all that, it goes right on her schedule. So again, I know we're talking about the specialty lens clinic, but having someone with her ability that is so well trained, you can stack them up with soft lenses and all that good stuff. And what I've done, we'll talk a little bit about this later, is I've given Robin, well, not myself, but the whole management team has given her a nice little commission on all daily year sales and all contact lens sales. So when she's in there doing these follow-ups with patients, she's motivated to sell, and she's the opposite of pushy. So our patients love it. She goes over all their benefits with them. So she's also really increased our sales for soft lenses. So it's been a win-win-win. So she makes a little bit extra money. Our practice brings in more money, and I see less patients for follow-ups. It's perfect. I can't imagine anyone not wanting to do it, to be honest with you. So, all right, how do you make your practice a well-oiled machine? We got the whole basics here of, okay, you need to find your superstar. You all know that now. Got to have your superstar. Got to have your contact lens extender. So what does a visit with us look like? The first thing it really depends on is who the patient is coming from. Is it from one of our 6 clinics, one of our other doctors? Is it an outside OD, MD referral? We've been getting a lot of self-referrals from that silly Instagram, Google, Scleralens.org is a nice one, NKF. So it all really depends on where they're coming from. That's the different workups. If we have a history, great. If not, we'll make do. But no matter who it is, we're going to do a full corneal evaluation on them. We're going to check we're going to run a pentacam to see exactly what's going on with that cornea, what we're working with. We're going to do a refraction. We're going to also go over insurance and what it's looking like. Do we think things are going to get paid for? Do we not think things are going to get paid for? And they also get a little folder on their way out. What Robin and I have done, and if you all don't do this, please, 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 please do this. Get something created for your patients that they walk out of there with. I get probably one patient a day, maybe two a day, that they're coming in, they've worn Sclerals before and they had a bad experience. No one ever told them anything. I don't know how true this is, but they were never given any information or anything. They're just kind of in the dark about all this. And what we've done is created a really comprehensive folder. And we've got just all the different products that we recommend. We've got a bunch of different pages of how to INR it. One from Bosch and Lum, the GPLI one you see there, front and center. The business card inside there is actually Miss Robin's business card. And so they've got her number and all that good stuff. A flyer about scleral lenses, I think that's from GPLI as well. And then a 25-page document, I'm not even kidding you, a 25-page document that I call the fine print. And what happened is, over the years of fitting these, as we were creating this and building this big clinic, Robin and I got asked every single question you can imagine, via email, in person, whatever it may be. And every question that we actually deemed, legitimate, we actually typed up a nice formal answer. And every single question that patient we think might have is in there. And so more often than not, that patient, especially if they're coming from us from a relatively good ways away, they read that whole thing front to back and they are just blown away by the time they come in. So the more information you can give your patients, the better. And this folder is a great way. It's a great practice builder. And it really gives the patients some comfort in the fact that, oh, wow, maybe these people know what they're talking about. Oh, wow, I got this very professional looking folder. This is really cool. So it's a good start. All right, so at some point in the first visit or before the second visit, Miss Robin or one of our other specialists take all this information and they go right to the billing department and they go to work. And they call the insurance, they do all this stuff, and they figure out whether the scleral lens or specialty lens is going to be covered by either vision or rarely medical. And once they figure that all out, they discuss whether it's an insurance, whether the insurance is going to pay for everything. Are they going to be cash pay? Are they going to do care credit? So then Miss Robin gets them on the phone and says, hey, it's Miss Robin, Williamson Eye Center. Here's what we're dealing with. Here's what we're looking at. Do you want to proceed? And the patient will agree or not. And if they agree, they'll pay. They'll usually will try to collect all of it beforehand. Sometimes we'll collect some of it at a later visit, at the fitting visit, but usually everything is paid over the phone at that time. And as soon as Miss Robin is comfortable with everything, as soon as all the I's are dotted, T's are crossed, that patient is scheduled for their second visit. And this is where we start to save time. This is where that, well-oiled machine starts to come into play. Patient comes in, checks in, Miss Robin grabs him, does a quick little workup again, basically just check and make sure nothing has changed. I'll typically have her do another pentacam just because a lot of these patients have very unique corneas. They'll bring them back and Miss Robin throws them in a room, and she knows me so well at this point, she knows I favor some fitting sets and some lenses for mild keratoconus. She knows I like some for very advanced keratoconus. She knows I like some for transplants, and I like another one for post-RK. So she already has a very good idea of what I like, and she'll actually have those fitting sets laying out for me in the room. Pretty cool. So I walk in, I don't have to worry about pulling, oh gosh, where's the Ampli fitting set? Or, oh, I really want to do a lens that I can oblate the middle or what have you. She knows all that. She's got it all organized. I walk into the room and it's there. So I walk in, the pentacam image is up on the screen. I look at it real quick. All right, that looks good. I pull my trial lenses. I personally put the lenses on the patient and I check the fit, make sure we're overall a good fit. If it's not, I pop the lens off, put a new one on, good fit. I say, okay, Miss Robin's gonna run some tests on you in a few minutes. I leave the room, go see some more patients. I'm sometimes only in there 2, 3, 4 minutes. All right, and so then what happens is that patient sits in there either with Robin or Robin will leave and see another patient or do some paperwork. And after around 20 to 30 minutes, Miss Robin grabs that patient, and what she does is she runs all the imaging that I want. Typically, we'll run with Topcon Maestro, we'll run a central clearance, an edge clearance, and then we'll do the full pentacam. And then she gets an auto refraction. Brings them back to the room and refracts over that scleral lens. I cannot remember the last time I refracted over a scleral lens. So, I mean, she's just saved us so much time right there. So I come in, and on our little computer screens, she's got all the images brought up for me already. So I'm looking at the central clearance, I'm looking at the edge, I'm looking at the pentacam. And, you know, of course, I'm not totally relying on just those images, but it gives me a really good idea of what I'm looking at. All right, excellent. And so then I also look at the refraction. Is that refraction making sense? So I look at all these images, and then what I do is Ms. Robbins already got a fluorescein strip ready for me. So what I'll do is I'll take that wet fluorescein, wipe it on the front of the lens. I'll look for my marks because I do almost exclusively toric periphery, like I'm sure most of you do. I'll look and see if there's any tear film, any leakage, any exchange, and I'll just kind of give a nice gross overview of that. I'll drop the blue filter out, take a look at the edges myself, and then I verbalize everything to Robin. Miss Robin's sitting in the corner of the room, and she's just typing away everything I say. You know, I might say, okay, our marks are at 3 and 9. We got a 42T at 12 o'clock. Ooh, we're getting some influx there at 6 and 11. Go over to the other, same thing. So she's writing all this out, and then I will pop the lenses out myself, just because that's pretty quick there. And I'll leave the room. Miss Robin answers all the other questions that the patients may have, make sure they know exactly when they can expect the lenses, and just kind of tighten all that up, make sure they're happy, all questions are answered. Then she walks them out. She prints all the findings. And what she does is, to keep me organized, I'll talk a little bit about the whiteboard in just a moment, but she does all this, emails me everything, and then prints out a hard copy and sticks it to a little whiteboard that we got in our little scleral lens section where Miss Robin works. And then whenever I get the chance, whether it's at lunch or just in between patients, which doesn't happen too often, I'll order them. And I'll use file upload sections on different manufacturers' websites and all that good stuff. So this is what the room looks like when I leave. This is a lot more organized than it typically is. Usually there's just tissues everywhere and fluorescein drips just every which way, but this is typically what it looks like. So Miss Robin's got her little workstation there in the corner. We've got our couple different fitting sets out. Again, that's what it looks like. And she'll clean all that up after me. This is kind of one of our little work areas right by Miss Robin's desk. The first picture there, you'll see that whiteboard, and that whiteboard helps me so much because I will be completely honest with you, there were more than a few lenses that I just completely forgot to order. You just get busy, and when you do a lot of fits, they just kind of, you just honestly forget. My fault. So just bought that little board off Amazon for, it was like 10 bucks, and it has saved us so much. I don't think we've missed an order off that since we've had that board the last year. So it's great. She does all the standard cleaning and all that good stuff. And this is actually a really ingenious way that I can't take the credit here, Miss Robin came up with for organizing all of our current fits. So we've just got some smaller manila envelopes, and she got the patient's name on the top, their identifying information. And when we get a lens, she writes pair number 1, throws the sticker on there from the lab, and what day it was received, what day it expires, did we dispense it, online credit and all that good stuff. And then with every new pair that comes, she just makes another row. And so this patient is obviously due to come in. I don't know what's going on there. And then the third picture is just all of our active fits right now. So not the completed ones or anything like that. Those are just the active ones that are waiting to be put back on the eyes. So it's a really ingenious setup. I love it. I'm over the moon with how she did this. So between the folders and this and that little that little whiteboard, we're really operating at a pretty high level with some pretty old technology there, but it works for us. So dispensing follow-up appointment, very similar to the fitting process, the fitting appointment. Patient comes in having worn the lenses or not having worn them, but having come in, Robin basically brings that patient in and she tries to put the lenses on the patients. And, maybe a third of the time she just has some difficulty. Patient doesn't feel comfortable. Robin doesn't feel comfortable. So if they don't feel comfortable, Robin just grabs me between patients. I come in, pat the patient on the back saying, "You're ready for your life to change." I'll pop the lenses on and say, "Oh, I'll see you back in a few minutes." Lenses settle for 20 minutes. Robin checks the visual acuity. She takes all those images that we mentioned, asks the patients how they feel, and then I come in and everything that we just mentioned earlier, we do again. So we check, we do the anterior segment OCT, or I look at all that, all those pictures are up, fluorescein strip, all that good stuff. So again, it works really, really, really well. We average around 1.5 remakes per patient, and I'm comfortable with that number. Robin and I will tell the patients that we're going to get tired of this before you do, meaning that honestly, we're going to keep remaking these things as long as we think that we can keep getting it better. And we've only had 2 patients out of hundreds upon hundreds that I finally had to say, I can't do any better. So 2, which is still very surprising to most people, but we've had 2. At the 1-year follow-up, this is where life gets a whole lot easier. So this patient, we scheduled with Robin and I. And it's important to note that the patient probably has been seen before. They haven't just gone a year without seeing anyone. There's a good chance that we're monitoring for their keratoconus. We're running them through a pentacam every now and again, or post-LASIK ectasia, or if they've got RK, they've got really bad dry eyes. There's a good chance they saw another Williamson provider at some point. And all of our providers have a pretty good idea of what to look for when the patient has a scleral lens on. And if it doesn't look good, they just send them right back to me. And that's happened on more than a few occasions. So the patient comes in for their 1-year exam. Robin does the full workup here. So she is like a normal technician. She's doing confrontation. She's doing all of that stuff. But when the patient comes in, she right away does those anterior segment imaging, the pentacam anterior segment OCT. She brings him to the room, checks the vision, asks the patient, "Hey, how you doing? Are you really happy with this? Is everything good?" If it is, the lenses are removed. And what we do then is I come in, do a normal exam. I'll try to refract them. Obviously, this isn't so much a fitting webinar because y'all know you're going to stain with fluorescein and all that. I'm not going to get too much into that. This is just more how to streamline things. So I come in, I finish the full exam, and I order the new lenses. And the lenses are always warranted, always, always, because I do like to tweak things, and patients love that. I will tell the patient, and Miss Robin reiterates the fact that, hey, we're going to order you some new lenses. They're going to start off pretty much the same as your last pair, but what we can do is we can make any changes. So, these are not going to be your final ones. We're going to order these up for you, and we'll see if we have to make any changes. But Robin does pretty much everything here. She finishes all the paperwork, runs all the insurances. At this point, she's a pro at this, and she has very little issues. And then for the follow-up, when that lens comes in, we do everything the same. I come in and just double check it all. How do we incentivize Robin? Commission. A little bit of this information is in that contact lens spectrum article. She really does like doing a lot of the 1-week soft contact lens follow-ups because she can make a good commission off those. But with the scleral lenses, she also gets a little bit of a commission for those specialty lenses because they're a lot of work. So she gets a nice commission there. And again, I like to use her quotes and from that article. She said, "At Williamson Eye Center, my scope of practice is as a nationally certified contact lens examiner. I'm an extension of Dr. Davidson. In his busy specialty contact lens practice, I work in tandem with him to provide the highest quality of care and service to our patient. So really, I think what's key there is she's an extension, and she feels that way. She feels that she's an extension. She can do whatever she's comfortable with. I am so confident in her training and her personality and her abilities that whatever she's comfortable with, she can do. And there's a lot of times where she comes to me and says, I'm just not comfortable with this. I've had her do pretty much whole fittings with me in the room. And we've had her just try to, she picks the first lenses and all that good stuff. So you've really got to empower your staff. In today's world of declining insurance reimbursement, and who knows what's going to happen with specialty lens reimbursements in the future, but as the reimbursements are going down, we've got to, you could argue, we've got to see more patients to continue to live that comfortable life and make our practice financially viable. And for that reason, I think that it's a great idea to get on board with these physician extenders. You're already used to your technicians. The scribes, I'm sure, has saved you a lot of time, especially with the move to EMR. It's time to have a contact lens extender too. Again, physician extenders work. They make the clinic flow way more smoothly. It's another touch point for your patients. It gets them even more loyal to your clinic. I worked at a different clinic before Williamson, and I did quite a few scleral lenses. And I get a lot of those patients that come to me today. Gosh, dozens upon dozens have come, and every single one has made a comment about how, wow, like this is so much more organized. Everything is so much better done. And I don't know about that, but everything is a lot more streamlined. And just having that lovable, likable face that Miss Robin is, it has made all the difference. Another thing too is the patients love the availability of having more appointment times. A lot of us are booked out for a long time. And having, okay, you want to see Dr. Davidson, okay, well, his next time is this, but Miss Robin can see you here and just double check a few things. Can see you tomorrow or today. There's something very powerful with that. And the staff knows that if the patient kind of gives some flack, to be honest, a patient on Robin's schedule, I can usually just bop in and take a peek myself. So patients love that. Specialty lens concierge, I love that terminology because that's really what she is. She handles everything, and patients feel extremely well taken care of because they're not going to get my cell phone number. They're not going to get my personal email, but they've got Robin's, and she handles everything like a champ. And the other thing too, and this is kind of corny, but not only can you develop a great coworker, but this is someone that's like your right-hand person. Robin's, just an incredible person, an incredible friend to me. And it's really made a world of difference. So I know it's kind of rambling. I really, really think this is something everyone should look at doing, especially if you do a fair amount of specialty lenses. And especially if you're, want to make more of a push to sell more soft lenses. Robin has single-handedly increased our soft lens sales by a huge, huge number. I can't even give you that number, but it's been huge. Win, win, win. So if you got any questions, reach out to me. There's y'all will get my personal email, and I'm on Instagram too. So do you have any questions?
Thank you. That was great. So while the questions are coming in, I thought I would ask you a couple myself because I was definitely intrigued. So how did you go about finding Robin, and did you have trouble finding the right person for this role?
Robin actually, I wouldn't say she fell into our laps, but we were actively looking. We had, we had ads out and all that good stuff, and we were looking at starting to train someone within our practice. And she was actually looking to make a move from Nashville or Austin. She worked in Nashville and Austin before us. And she just kind of fell into our lap. She'd already attained her NCLE, but she'd never fit a scleral lens before. She'd never touched a scleral lens before. She'd been working with an old timer that really did a lot of gas permeables. So she just kind of fell into our lap, answered the ad, and brought her in. She knows a ton about gas perms, a ton. Honestly, I think more than me. But she didn't know a thing about sclerals. She was very intimidated. So all the scleral training had to come from us. So to answer your question, she answered an ad. She was in Austin or Tennessee, one of those two, before she came to us. And then we trained her on sclerals.
Very nice.
And sorry, I want to go a little further, but all of our other Robins, you know, in our other clinics, because we have 6, we've got a lot of ODs, all those other Robins, the doctors kind of chose. They're like, oh, you know, Lacey is a wonderful, you know, technician. We're going to bring her in and we're going to train her in contact lenses. Or, oh, hey, JQ is a cool guy. Patients love him. He's got a great attitude. Let's train him how to do this. So the rest were kind of just chosen by doctors. But Robin is really still the superstar, and she helps us train the others.
Yeah, and do you feel like she ever wanted, like, is it kind of like a permanent position for her, or did she ever want to like do more training? Like, for example, my technician wants to be an optometrist. So is that something that you were afraid of, or?
No, Robin's in her late 40s, and she's settled down here. She's got a husband. She has no interest in optometry school.
Very interesting. So what else do you think that you would recommend for, like, I guess to all those who are starting out in scleral lenses and may not have like the setup that you have, or the equipment or the technicians? Like, what do you think is the best way to get started?
Great question. And that's actually what I did. I started off with nothing. When I left my old practice, I didn't even have fitting sets. I just did a lot of scleral lenses, and I had a pretty decent reputation around town. So if you're just getting started, the first thing I did was I called all the labs that I had been working with, all of them. And one of them agreed to send me a free fitting set. So to this day, I am incredibly loyal to that lab. And they sent me a free fitting set. They sent me, you know, the DMVs. They set me up, and I got started. I just, you know, started putting the lenses back on the eyes. I did it all myself. We ended up getting so busy where we were doing multiple fits a day that I went to our administration and the rest of our management team and said, hey, I need my own extender. And they were like, what? No, you don't. You know, we don't. You know, our surgeons get all the extenders. You got technicians and you've got scribes. I said, no, I need someone that is just devoted to contacts. And it took some work, but I got it. And the rest is history. And now pretty much every clinic is getting their own.
So you're talking about scribe. Do you find that, are you using electronic health records, and does this person type? Okay.
So she does everything.
And does she do the orders for you, or you're ordering?
Great question. Great question. And how did I not mention that? I still, to this day, I order everything, either on my lunch period or in between patients if I catch a break. I personally will call the lab or do the file uploads online or send the emails. So I still personally do all the orders myself, unless you know, Robin has the ability to do, you know, remakes, or hey, I broke my lens, all that good stuff. I think I had 2 today that I sent her emails today. She's actually out of town right now. So I actually sent her some emails today saying, hey, this person needs a new lens. This person needs a new lens. So she'll order that up and collect and all that. But to this day, I still like to order the lenses because I like to hear what the lab thinks should happen. And then I also like to throw my little flair in there too.
Yeah, I'm definitely OCD with the lab ordering. I think that's like the one thing I would never delegate, just because it's like, did they do it right? You know, and
it'd be a lot easier. It'd be a lot easier if I just let her do that. But I think that should be the doctor, to be honest.
I agree. And you brought something up about her being out of town, and that raised a question to me, is when she goes out of town, do you significantly reduce your workload, or do you like take someone else who's like less experienced? Or
Great question. So this is the first time in over since pre-pandemic that she's not there with me. We usually take vacations the same time, and I'm lost this week. I'm completely lost. Like I've had to cut my patients back. Yeah, it slows you down substantially. So, right now this week, I'm only seeing maybe 20 dry eye patients, and I'm not doing any new fits this week when she's gone. Just because the infrastructure is, it's easy to kind of tone things down a little bit, but my life is so much better, easier, and more efficient with her there. I haven't grown, I can't do my job without her per se, you know what I'm saying? But I prefer to do it while she's there. So yeah, this is the first week, this whole week she's gone. It's the first time, and I can't even remember that she's not there. And I've definitely had to slow down quite a bit. And then when you look at the financial aspect, you're like, wow, I'm seeing so many fewer patients. She's really made my life a whole lot easier and really made me a lot more financially viable. So today, or this week, is proof that just how valuable financially she is.
So it's almost as if you should take your vacation at the same time.
We always do. We always do. But it just didn't work.
All right, so I do have a few questions that came in from people listening. If a patient is referred by another OD or MD, do you perform a comprehensive diagnosis?
Oh, are you there?
Results alone for posterior segment health?
Oh, I lost you halfway through that question. So I heard comprehensive exam.
So the question is, if a patient is referred by another OD or MD, do you perform a comprehensive exam and do the dilation, or do you just refer to the outside doctor's notes for the posterior seg?
If they send notes, I honestly just use their notes. I trust them. All the doctors that send to me, they're all great. I have great relationships with them. And what I will do is I'll do a quick undilated. It takes just a few seconds. I'll take a quick little picture. And if something seems out of the ordinary, I might, flash a Claris or an Opto map on them. But all the ODs that send to me and the MDs, I trust them. So they're sending that patient to me for a scleral lens. I'm not in the business of taking them, taking their yearly business for their comprehensive exam. Now, I get a lot of referrals from corporate eye doctors, and they said, all right, just take the patient. I don't want them back. And so for those patients, from those doctors, yeah, I'll do the whole shebang. But a lot of the private ODs, especially some of the older folks that they don't want to do sclerals, but they know the patient needs it, I'll do the scleral, send them back to them for their comprehensive.
Great. Another question is, does the practice provide financial support to take these certifications to the staff?
Yes. Yeah. Our practice pays for your first test. And if you pass that test, you get a certain raise. What that raise is, I'm not entirely sure. But if you pass the test the first time, great. If you don't, then all the subsequent tests you have to pay for.
Okay. So many state laws do not allow techs to refract or use the slit lamp. That kind of holds us back, according to this attendee. How do you get around that?
I've never heard of that.
Okay.
So that's a non-starter in mine state that I know of.
Yeah, I mean, like I have students shadowing, and they can do some of that stuff. So.
Yeah, I haven't run into that problem. If that is the case, then you could still get by having the Superstar contact lens extender. Just don't have them refract. Run an auto, have them throw that thing in the phoropter. You can still have them run the OCT, the Pentacam, all that good stuff. You can still have them bring that up on the computers. They can still have that fluorescein strip ready for you. You can still save a ton of time. They can still do your scheduling. They can still route them on for INR. They can still do a ton.
Yeah.
I don't know any states that a tech can't refract. I don't know if that's a thing. I'm curious. If that person can tell me the state, I'm really curious. Because
Yeah,
that state, that's interesting.
that is interesting. A lot of questions about what happens if Robin's out, so I'm glad I asked you that.
Yeah.
And then someone asked if you feel comfortable, of course, giving us an idea of what a typical compensation for a position like that would be. Obviously, you don't have to tell us the exact number, but maybe some sort of a range that you would recommend.
Yeah, depending on your market, I would give them a base, okay? And I would say that base should be anywhere from 18 to 30, depending on your market. And then, of course, commission.
Okay. And then if you get a referral from an optometrist, how do you honor the referral? I guess you kind of explained that in your posterior segment evaluation, that if it's a corporate, you're more likely to hang on to it if you feel like if it was sent to you as like a permanent transfer versus just kind of like a contact lens issue. Is there anything you want to add to that?
No, and I think I should specify the corporate. All of our corporate doctors are completely different. I get referrals from a lot of them. There's national vision doctors that just say, hey, and I used to work with them, moonlight them, they're great. They say, you know what? They need to be with you. They got a diseased eye, they're yours. So of course I'll do everything. A lot of our Walmart docs, Sam's Club docs, Costco docs, they want to see those patients every year for their health exams. So for those corporate docs, I will just do the same thing I do for a private practice doc.
Excellent. There was a question about, if someone doesn't fit a lot of scleral lenses, what you would recommend. And you did mention a whole bunch of resources at the beginning, so thank you for that. And I think that's what I think would be the best place to start. I don't know if you have any other recommendations.
SCleralensorg. I mean, that's the website. God, Dr. Kramer, when was that redone? Because it's been redone fantastic. I mean, it is incredible website.
Yeah, there's Dr. Wu who, when she was president, redid that a couple of years ago. So yeah, it looks great, and we're always working on it to update it. So
that's your best resource. And to be honest with you, a lot of labs have got a lot of little things that you don't even think about. For example, there's a lab that I work with that we're going to be hosting a regional seminar down here in the Southeast. So maybe you're from Mississippi and you're like, all right, I want to start fitting these things. In the fall, you'll be able to drive over to Baton Rouge and see how we do things. The Scleral Lens Education Society, we're at pretty much every meeting, and Dr. Kramer is she's speaking at all the meetings. And, we're doing little seminars, we're doing training events, and we can kind of walk you through some basic fitting. The hardest part is just putting that first lens on. That's the hardest part. If you've never done it, just get a fit set, however that may be, buy one, rent one, you can rent them, and just throw it on an eye.
So they did say that it was Kansas State that they're not allowed having techs refract, but I think what they mean by that is having techs like sign off on a refraction, which I don't think you can do in any state. So no. I think if you have someone refracting for you and then you recheck it and then finalize it, I think that can be done anywhere.
Yeah.
So thank you so much, Dr. Davidson. That was really informative, and I'm definitely going to read that article. So if you could send that to me, and then I can send it to everyone here if you're open to sharing that.
Absolutely.
Dr. Davidson, I would love to have you up here again and learn more from you. Thank you again.
Absolutely. It was a lot of fun. Thanks, guys.
Thanks.